at Griffin Hospital. So yes, I grew up in Derby, and then I live in Seymour. Now I live in Oxford.
I was born at Griffin Hospital in 1940.
I was born here in 1928, and my brother and sister were born here, and a lot of my friends were born here.
I was born here. I've worked here since I was 17 years old, and it's a part of me.
I grew up in this neighborhood, and I can remember even as a very young child taking walks with my dad and walking by the hospital and kind of just looking at it and feeling like, you know, there must be great things happening in this big brick building.
Griffin Hospital is located in the city of Derby, and Derby is in the lower Naugatuck Valley in southwestern Connecticut.
Griffin's 100 years old this year. Started in 1909. It's a little different than it was back then, but I think the mission is still the same.
The hospital actually opened in 1909, but there are a group of community-minded residents who got together a few years before that, and with the leadership of George Griffin and his generous donation of his sailing schooner and other sort of assets that he pledged to support the creation of a local hospital.
That was sort of the seed money which started the Griffin Hospital, and in fact in the first quarter of 1909 the board did vote to change the name from the Derby Hospital to the Griffin Hospital.
And the hospital was relatively small at the time, 25 beds, and it grew a little bit from its founding into the 1950s, but there were some major expansions in the 50s and 60s. And the modern hospital, as most people know it, really didn't exist here in the community until the late 1960s. And that served the hospital well until not only the 68 edition, but the earlier parts of the hospital, the community pavilion, the center building, kind of deteriorated a bit. And we, at one time, in the late 80s and early 90s, had the oldest physical plant of any hospital in the state. We were forced to think about major facility replacement, and that's what led to the creation of the North Wing, which opened in 1994.
First came into Griffin Hospital, I just stood in the lobby and it just felt like home. It was like a place you wanted to be in. As a nurse, that says a lot, because working in various hospitals over my long career, there were hospitals that you just wanted to run, you know, don't walk, just get out of there, because they just were awful hospitals.
I know everyone, or I feel that I know everyone. There's just a natural comfort being here that you don't feel at other hospitals.
I first arrived here, the hospital, in terms of providing medical care, was at a very elemental level, because they were primarily general practitioners. The hospital has to be like a university if it wants to be good. It has to be teaching as well as taking care of people.
When you have a vibrant teaching program, you attract a higher quality medical staff. And I think that has happened. I've seen that happen over these several decades, where we now have a medical staff that basically is comprised of every subspecialty in medicine as well as in the other areas.
You look at Griffin, when you look at the processes of care, when you look at clinical outcomes, when you look at the patient experience and patient satisfaction, when you look at things like efficiency, Griffin is considered as being within the top 5, or in some cases the top 1% of all hospitals in the United States.
Why has it changed? I can't really tell you, except management and the medical staff and the lay board members have worked hard to make that happen. We have a sense of making that happen, and I think that sets us apart from other hospitals in the area.
Griffin has become a model in healthcare throughout the state of Connecticut, throughout the country, throughout the world.
In 1984, it wasn't much different than other hospitals. It was a nice little hospital. Nursing care, I could see, was excellent, but it was dark, it was cluttered, it was noisy, and so it was I was very comfortable because that's what environment I was used to working in. Now it's not that way at all, and it hasn't been that way since 1994.
Prior to those kind of unique facility improvements, I think Griffin was more a traditional hospital, like many community hospitals around the state and around the nation.
About 1992, we had an operations meeting, which is the administrators, and at that time we realized that we would not be in business in 5 years if we didn't do something drastic.
It was really an opportunity for us to redefine what the hospital environment should look like for patients.
And Plaintree fit our needs. It was patient-centered. We would include the patient. We would create an environment that was healing in itself.
And that's what Plaintree at Griffin is, and that's how it evolved. Really thinking about care delivery from the patient's perspective. To do that, we had to overcome a lot of conventional wisdom. Everybody, I mean everybody, saying, well, that's not the way that it's done.
The only reason we're here is because of patients. If we didn't have patients, we wouldn't be here at all. And our job is to make this as positive an experience as possible for the patient and for the patient's family as well.
This is the jacuzzi room. Moms who are coming in labor, if they're having any kind of discomfort, what they do is we can fill the tub for them, and they can hop in there and spend some time in the jacuzzi. It's very soothing, it's very relaxing, and it really is something that promotes a very comfortable labor experience, and it's a great thing and one of the wonderful facilities we have here at Griffin Hospital.
This is one of the rooms where the patients stay when they come in for a sleep study. So as you can see, it looks very much like a hotel suite. Try to make it as comfortable for the patient as possible.
We oftentimes ask the patient, would you like a visit from a therapy dog? And you see the eyes light up and the face soften, and it's just a wonderful surprise for them. They don't expect it sometimes.
I love these. Oh, I love little dogs. My wife was a patient here, and I seen how good they treat their patients and their visitors, and I wanted to be associated with them.
It's like a family hospital. I really enjoy everybody, knows everybody, and it's just comfortable working here.
I've actually had my own surgeries done here when I've needed surgery. They've operated on both my parents here at Griffin. I flew them up from Kentucky and they had surgeries done here.
The people are very nice. They take care of your needs. If you have anything, all you got to do is ask. They're right there for you as soon as they can possibly be there.
I think really what makes Griffin shine above everyone else is the people, the staff that work here. And the people are committed to providing the best in health care to the individuals that walk through that door. And there's no doubt that the fact that the people that work here at Griffin have embraced the Plaintree philosophy has made us a model institution, medical institution here in the state of Connecticut.
Good afternoon. Welcome to Griffin Hospital.
Happy birthday, Griffin!